using a retinol is super important, but you have to make sure you're a candidate. Like, for example, if you're pregnant, you can't be on a retinol. If you're trying to get pregnant, it's iffy. You probably might want to stop.
That is Dr. Rahi, a top integrative aesthetics specialist in Beverly Hills, California. She joins me today on our Elegance on a Budget series to discuss elegant skincare for women on a budget. In this discussion, we talk about skincare routines from teenage years.
And as a teenager who's trying to develop a skincare routine, what products do you think are most important?
All the way through adulthood.
What do you recommend women in their 30s focus on when it comes to skincare?
Foods to improve skincare. How to prevent dry skin.
Growing up, it's changed now, but when I was growing up, we were kind of told Black people don't need to wear sunscreen. And that was a big thing. Like, we don't have to do it. We're so lucky, right? Our skin can take in the sun.
Yeah.
But that was not true.
Right.
And it was not true for me.
Anti-aging for your skin. And I even tried one of her treatments. Although I received something different from what I signed up for, it was amazing. We also touch on the most important part, having a great skincare routine on a budget.
And you talked about the internal piece of skincare and how that integrative medicine, it takes what's going on the inside and sometimes manifests on the outside. What are some things with skincare that manifest on the skin, that show up on your skin, that has to do with something that's going on the inside?
A lot of diseases will start in the gut, and everybody is different, but inflammation is kind of the root of all disease. And a lot of skin disorders such as acne or psoriasis, eczema, I mean, there's a long list of different conditions. They can all start internally, and you have to investigate individually. It's hard to say, oh, everyone got, every single eczema patient has the same root cause.
So basically what you're saying, a lot of things that show up on your face may not just be surface level. It could be something a lot deeper than that.
Exactly.
I see. When do you think is the best time for a person to develop a skincare routine? What age would you say?
Right away.
Well,
I think the parent should definitely take care of the baby's skin with products that are appropriate for babies. But as children are growing up, it's important to incorporate skincare as we incorporate brushing our teeth or brushing our hair.
And as a teenager who's trying to develop a skincare routine, what products do you think are most important? Because skincare can be expensive.
Yes.
And as a teenager, they may not need something that costs $100.
Right.
But what products are the most important, in your opinion, as a teenager?
Okay, definitely a face wash. I think that's for any age. So getting that morning and evening, maybe throughout the day if needed. And if we're keeping it super, super basic, then maybe just a sunscreen.
Okay. And then what about someone who's in their 20s? What are some important skincare?
Definitely face wash again.
Okay.
And there's different types of face washes, and there's oil cleansers, and then other face washes that treat acne, and more gentle face washes. So that is something that you got to figure out with your provider, what the right product is. At that point, you can probably start adding some serums. Like vitamin C is really nice because it'll help protect your skin and also help reverse any sun damage. But usually sun damage doesn't start happening until the 30s, I'd say.
What does sun damage look like?
It usually looks it could look like a freckle. That's a good way of explaining a freckle.
In the African-American community, when I was growing up, it's changed now, but when I was growing up, we were kind of told Black people don't need to wear sunscreen. And that was a big thing. Like, we don't have to do it. We're so lucky, right? Our skin can take in the sun.
Yeah.
But that was not true.
Right.
And it was not true for me. And when you talk about sun damage, I ended up getting a ton of freckles and moles.
Yeah.
Even though it does run in my family, I got it at a very fast rate because I was in the sun.
Right.
And not wearing any sunscreen.
Yeah, I mean, wearing sunscreen is very important. I'd say for My favorite type of sunscreen is mineral sunscreen just because it's like safer for the environment and I feel like it goes on easier and it's great for all skin types. But it's not just about preventing skin cancer when we're saying let's avoid the sun. Well, I mean, I do think there's a good amount of sun that we should be getting on our skin on a daily basis to get the vitamin D, but I'm talking about face and neck. And so not only does sunscreen help protect against certain skin cancers, but it can also protect against hyperpigmentation, which can happen in darker skin tones, and also, sun damage. Yeah.
In your 20s, do you recommend that women do exfoliations on their face?
Definitely.
Part of their regimen?
If you're struggling with acne, I would, get a good micro exfoliant, like the very gentle ones, not those harsh ones that I'm talking about.
That kind of like
one.
rip your skin, like the ones that feel like rocks, like rocky.
Yeah. I'm talking about like the micro scrubs. Those are really nice. Exfoliation should happen at every age because your skin has pores and, we're exposed to pollution, the environment. And so having a good exfoliating regimen is important.
I see. At what age would you recommend that women maybe who are considering retinol start? Well, can you actually explain what retinol does for your face? Because you start hearing this word being thrown around in your late 20s. Oh, you need to use a retinol.
Yeah.
It's like, it sounds like a scary thing.
It does. Yeah, well, because it definitely is a medication. And at higher doses, it can cause sometimes redness, irritation, flakiness. But the purpose of retinol as a topical application or derivatives of it is to help the skin turn over. So it helps prevent fine lines, wrinkles, and it also helps treat sun damage, melasma, and other conditions. So using a retinol is super important, but you have to make sure you're a candidate. Like, for example, if you're pregnant, you can't be on a retinol. If you're trying to get pregnant, it's iffy. You probably might want to stop and just, testing it out and starting it slowly. Because if you start it pretty quickly and start putting it on every night, you can get really irritated depending on which product you're using.
I see. So would you recommend that people are going in to see like a dermatologist regularly as part of just their self-care routine, or is that for when they actually have a skincare problem? Would going to an aesthetic spa be more of something to integrate into their lives versus a dermatologist?
I think all clinics are different. There's some dermatologists that do pure dermatology with no aesthetics at all. And then there's some dermatologists that do pure aesthetics with no, medical dermatology in the sense like they don't treat like skin cancers. And then there's some that do both.
Okay.
And then there's some aesthetic clinics like such as mine where it's focused on not just external but internal, where we bring everything together and try to look at the patient as a whole. So it depends on where you are and what options are available.
I see. Now let's talk about the 30s because I'm in my 30s.
Great.
Thank you. What do you recommend women in their 30s focus on when it comes to skincare?
Same thing as the teens and the 20s, face wash, adding a vitamin C. Definitely something for hydration. Okay. Something that has maybe hyaluronic acid or a product that can hydrate the skin.
Yes.
Especially when it's hot out. And I love retinol, so incorporating a retinol. It depends again on your skin, problems if you have any. There's this really nice glycolic overnight mask that really helps resurface the skin with from SkinCeuticals, and you put it on maybe once a month or something, and it'll really help brighten your skin the next day.
Wow. Is there something that you notice? Obviously, water is important, but is there anything else that women can incorporate into their diet that can really help with hydrating their skin, brightening their skin, or just the overall health of their skin?
There's lots of things.
What things have you found? I mean, we hear water all the time.
Well, water, but you have to have water with electrolytes. Otherwise, your body doesn't absorb the water. So making sure there's electrolytes and also making sure that you have magnesium and absorbable magnesium. So magnesium glycinate, threonate, those are some of the examples. So what was the question again?
No,
I
it's
like
okay.
lost. I'm like, what?
What are some things that women can maybe incorporate into their diet that
Oh,
can
okay.
help their skin?
So again, it depends on the person, like what condition, if they're battling anything or if it's for prevention. For example, anti-inflammatories like turmeric. I love taking like a turmeric supplement. That's anti-inflammatory, and it's not just for my skin, it's for overall
Oh, yeah.
wellness,
So good.
right?
Yeah.
Incorporating certain foods like berries, cherries are really nice for skin health. Eating
Okay.
fresh cherries and eating more plants overall.
Mm.
So having a balanced plant-focused diet is my recommendation, as well as certain supplements. Like I said, the magnesium to me is really important. Turmeric is really important. Making sure you're on vitamin D, and you should get your levels checked to ensure, so you know what the dose is, and monitor it so that you don't take too much.
I see. Wow.
Those are some, yeah.
That's super helpful. I mean,
Thanks.
these are things that you can pick up at, your grocery store. They don't cost a whole lot of money to be able to do, and that matters.
Well, one thing, just make sure, like, when you're picking supplements, try to find ones that are, made well.
And how would you do that?
They're, I actually forget the name of the website, but there's a website that like will list like all the supplements that have kind of been approved. I'll get that info for you.
Thank you.
Okay.
Thank you. And in terms of just keeping up with your skin, when you hit your 30s, or when I hit my 30s, I should speak for myself, I did notice that my skin appeared more dry. And like how you were saying, a hyaluronic acid is really helpful with that. And I've done things to kind of help hydrate my skin in terms of like the kind of makeup I'm even wearing that was like drying out my skin, and powders and things like that. I've changed the way that I do my makeup and what makeup I wear. That makes a huge difference. But one thing I have noticed are like smile lines and things like that show up more so in pictures, especially when I'm wearing makeup.
Yeah.
At what point do you think it would be suitable to start considering things like Botox?
Well, Botox is not going to treat smile lines. Botox is a neurotoxin, so it temporarily paralyzes a muscle. So when you put it in like the forehead, it'll like paralyze the movement of the muscle. You don't want to put it in the smile lines because then you'll get a crooked smile.
Okay, we don't want that.
So as we age, there's a lot of things that happen in our face. It's not just the skin. So the skin breaks down. We have hyaluronic acid, elastin, and collagen in the skin. So as in our 20s, we start breaking all of that down. So it starts really manifesting in our 30s, but it really starts happening in our 20s. Yeah, I know. That's why prevention is really important. If you prevent, you'll have better results, more natural looking results than if you are frantic at the age of 15 trying to fix everything.
Right. And it's expensive to try to fix everything, right?
It's more expensive to try to fix everything for sure. Yeah. So the skin structure changes, the fat in the face changes, it moves around, and then the muscles change, and the bone also changes. So as we age, we lose bone in our mid-20s.
Wow.
And yeah, you've heard of like osteoporosis of, people like in their 80s, but think of that in the face. So like your bone is hollowing out. So that's why people have more dark circles, more smile lines. So if you want to help reverse that or make it look more natural, I'd recommend radiofrequency with microneedling and maybe a little bit of filler.
The filler.
Yeah.
That's what I was thinking about. The filler and the Botox. Those are things that I see a lot of women around my age, especially here in LA.
Oh, yeah.
Everyone gets filler, and mostly
everyone in LA.
They get fillers. But that's more appropriate for smile lines and things like that.
I wouldn't necessarily put it in the smile lines. Be careful of putting too much filler there because it'll like puff out your face. So the better place is usually under eyes or cheeks to like lift everything up. I see. Because as we age, it like ages forward and down. So our goal is to go up and back.
I see. One thing I notice when it comes to doing things to your face, especially again here in LA, is that a lot of women, and I'm sure men too, they get to a point where it's like they have to do more and more and more each time because they're kind of chasing that look that they used to have. And then they start just looking completely different and it looks noticeable that they've changed their face.
Yeah.
So someone like me, I'm terrified of doing anything to my face. You know,
I
I'm
get
like,
it.
let me just embrace
Mhm.
aging. But at the same time, when you're on camera all the time, or a lot of these people are actors and, you know, their face is constantly being shown to the public, they feel more pressure
Yeah.
to do something.
So luckily what I do is all minimally invasive, so I don't do any surgical procedures. The only thing that I could think of that would give a weird look is too much filler, which I pride myself in not doing on my patients. However, if you start looking weird, you can always dissolve the filler.
Oh, I see.
So that's one thing. I mean, the goal isn't to dissolve the filler, but I'm just saying if something happens, you go overboard, you got too much filler in your face,
Right.
you can start dissolving and then maybe start from scratch again.
Okay, I see.
Yeah, but I think all of the other procedures that I offer are pretty natural looking.
Mhm.
Maybe like during or maybe the healing process, there might be some swelling or some aftercare that you have to do, but the end result is very natural.
So what are some preventative services that you offer that can help a woman to just kind of keep her skin and her face looking as
Mhm.
healthy and, you know, as youthful as they would like it to look?
My favorite thing is microneedling.
Yeah.
I think it's like I think it should be like the staple of everyone's sort of skincare routine.
Okay.
But there's different types of microneedling, like mesotherapy, where we put some vitamins on the skin and we don't go as deep. And then microneedling with a microneedling pen, and you know, you can put exosomes on top, or microneedling with radiofrequency. So there's different options, but I think definitely microneedling for sure.
Can you explain what microneedling actually is for someone who's never heard of it?
Yeah. So traditional microneedling is a pen, and at the tip of it is a needle. Well, it's a tip, and the tip has multiple small needles. And obviously, it's a one-time use tip. And these, you numb the face, and then the machine will puncture your skin like rapidly with these needles. And what that does, it stimulates your immune system, because your immune system is like, oh, something's going on, something's wrong. And then all the cells that are like regenerate come to the surface and regenerate and help stimulate more collagen and elastin. So you're kind of like tricking your body in a way.
Is it painful?
No, we numb you pretty good. I have 2 different radiofrequency microneedling machines. One of them is a little bit more painful than the other, but the results are worth it.
And how often would you have to do this microneedling process?
Initially, for sure, I would do 3 sessions, 1 month apart. And then you can space it out like maybe every 2 to 3 months. But if you have the ability, then I would do it every month forever.
Oh, wow. What kind of clients do you typically have? What kind of people typically come to see you?
All types of people.
Okay.
Like men, women, obviously more adults, you know.
Are they referred like from dermatologists, or is it
No.
something that they just kind of stumble
Word of
upon?
mouth.
I see.
I do a lot of social media stuff too, but mostly word of mouth.
I see. Because I'm thinking if a person doesn't know that these things exist,
Yes.
like say a young woman who lives like in poverty one day won the lottery, which literally just happened to someone that was living on Skid Row here in downtown LA.
No way.
Yeah, like a lady who's homeless literally just won the lottery, won millions of dollars.
Oh,
But say she just wanted to start enhancing her life.
yeah.
It's difficult to know like what's even out there. You may want to just say, oh, I just want to look better. I just want to have nicer skin, nicer hair, nicer clothes, but not knowing where to shop and where to go. So I do find it interesting that people don't really know these things are really out there.
Yeah.
You know,
So, I mean, I try my best to spread the awareness. Like I'm here and I
yeah,
do my social media.
great job.
But I guess the more people that learn about it, you know, you'll tell your friend, they'll tell their friend. But I think it's becoming more and more popular. You know, than when I started, it's all of these procedures are much more popular.
They are. And I got the opportunity to come see you. And can you tell them a little bit about the service that you gave me? But before you tell them, I was completely shocked because I had something totally different in mind when I came to see you. I was looking for a 24 karat gold facial where I believe from what I have seen, they put like real gold on your face and it just
Yeah.
helps like illuminate it. But that's not what I got, which it's okay because what I got was really awesome. But I hadn't even heard about the treatment that you gave me before.
So
So,
that's a form of microneedling. What we did, it's called
okay.
mesotherapy.
Okay.
The reason why we call it 24 karat gold is because the needles are plated with gold. Um, yeah, unfortunately, we don't put gold like all over. But I don't think that's as effective as what we did, anyways.
Right.
And then we choose like a selection of vitamins, for example, hyaluronic acid and vitamin C or vitamin A. I have like a large selection of different vitamins.
Hmm.
And then we'll create microtrauma in the skin and then put the vitamins on top and let your skin absorb it.
So initially I was completely like freaked out, like, oh my gosh, I see these needles, like needles are gonna go into my face. But it ended up being good at the end. And I mean, like a few days later, when I
Mhm.
started putting my serums and things on, I just noticed that my skin looked a lot healthier. And I just felt like things really were like my oils were absorbing better.
Yeah,
And my makeup just sat like just a little bit more smooth, I guess.
exactly.
Yeah. And
Yeah,
so
for
I,
sure.
I saw the results, but I was definitely not a fan of the process. And
Oh,
well, it wasn't bad. Like I've had
yeah.
things that are more painful.
Yeah.
But I guess also just not expecting that was part of it. But it is something I could see myself doing again for
I mean,
sure.
I definitely recommend it for everybody. I think
Yes.
it's not, you don't necessarily have to do the mesotherapy. You can do maybe traditional microneedling. That
Okay.
might be nice for you to try.
Okay.
Yeah.
And with something like this, how can a person who maybe doesn't have the budget for it? Because typically for
Mm.
things like this, what is the price range? Like not even just for you, but in general, how much can one microneedling treatment run a person?
Again, that depends on like what
Where they
area
go.
you're in.
Hmm.
Something in Beverly Hills might cost a little bit different than in Nebraska.
Right. But here in
But
LA, I guess you could say.
I think microneedling, general is around like 500 to 1500 a session.
Hmm. So that's pretty expensive.
Yes.
And so it's something that, a person would probably have to know, okay, at this time in my life, this is something that I want to start integrating and just plan for it.
I think so. I mean, we plan for our dental visits,
Mhm.
we pay for our cell phones, we pay for our nails, we pay for our hair.
All kinds of things. As women, we pay for so many
It's
different
so
things.
expensive.
It's
It's really expensive to be a woman.
it
Um,
is. It is
so
so
expensive.
expensive.
I always tell my patients to plan out for the year.
Okay.
When there's a will, there's a way.
Hmm.
I believe that.
Absolutely. Now, in terms of skincare, I'm doing a series on my channel where I'm talking about how to live an elegant lifestyle and just become more of an elegant woman on a budget for those ladies who live in areas where they just don't have the money because maybe they grew up in poverty or they
Yeah.
have children at a young age and just different circumstances that life throws at you where you just see something that you like and you're like, I want to be like this because I feel like this is who I actually am, but I
Yeah.
don't have the money right now for it.
Hmm.
What can a woman like that do to create a skincare regimen for herself? Like, how can she do these things on a budget or even get treatments on a budget? What would you say?
Well,
Yes.
I'm not the biggest fan of Groupon, but there are always Groupon deals.
Well, it's
I-
there.
It's there. You just got to make sure the reviews are good and the place you go to is a good place.
Mm-hmm.
And then just really having a really good skincare routine is the foundation of it all. So if you cannot afford to get the microneedling, just make sure you have a great skincare routine. And getting extraction facials is usually less expensive than microneedling. So maybe that can be an option to hold you over.
So, in terms of this woman getting skincare products, what skincare products in a woman in her 30s or 40s do you think would be essential at that point? I mean, obviously the cleanser,
Yeah.
but
Cleanser,
outside of that.
some sort of hydrating serum.
Okay.
And it depends on how dry your skin is. If it's really dry, then a moisturizer on top.
Mm.
If not, then a sunscreen.
Oh, okay.
I also would invest in an eye cream
That's
and put it all around your eyes. Don't forget like the top lid.
Oh, that's true.
Yeah.
That's really important. The eye cream.
Yeah. And nighttime, I would alternate the retinol. I wouldn't do retinol every night. I would do maybe like 2 to 3 times a week, and then with a hydrating moisturizer at night. Alternate it, and just look at all the ingredients, making sure that they're as clean as possible.
So the brands that have like the green skincare,
Yeah.
they're green beauty brands, and sometimes they use plants that have very strong ingredients. It's
Yeah.
not chemical,
Yeah.
but they're pretty strong. Is there a difference in terms of what you're going to see in your skin if you went like all green and just use green beauty only versus the products that are retailed in the stores?
So I think that's a difficult question to answer because there's so many products out there, so many different ingredients. I think it depends. In general, if I'm just generalizing, green products are a little bit more gentle. So they're really great for example, if you're traveling, because you don't want to take anything harsh with you when you're traveling. If you're just starting out, I would, start with that. But yeah, it really there's just so much skincare out there. It's hard. It's hard to really choose.
And if a person had a budget where they could only spend like they could only buy one expensive product, like only one skincare product that was expensive, where should they put their money? Because sometimes you'll see a cleanser that's $100 and the person thinks, well, the cleanser's on my face for like 3 seconds.
Yeah.
Why am I going to spend $100 on a cleanser versus a moisturizer is on my face all night, all day? That makes more sense. But in your opinion,
I'm thinking either the vitamin C serum or the retinol. I would say the vitamin C serum. You can put that on day and night.
But there's so many different vitamin C's. From what I've been told, a lot of the vitamin C's that are on the market are not really even doing anything. Like it's not even enough. It's not potent enough. It's not like, I guess, like real vitamin C. I don't know if that's true, but...
Well, I don't know like all the skincare that's out there. The ones that I use are, the ones that I offer at my clinic are definitely, they work really well. I think it's sometimes you just got to try it and see if it works for you. If it doesn't, then move on to the next.
That's true. So is there anything else that you think is extremely important for women to know about their skincare and aesthetics? Is there any treatment that every woman should definitely try outside of the microneedling, of course? I know microneedling. Is there anything else that you think is just important for women to leave with?
Consistency, I'd say. Being consistent with your skincare routine, being consistent with your aesthetic appointments. Being consistent will lead to more natural looking results and long-term results.
Thank you so much, Dr. Rahi. It was such a pleasure
to
be able to have you work on my face and to be able to interview you today. I really appreciate your time. I know you're very busy, but thank you so much for teaching us about how to take care of our skin.
Thank you so much for having me.
And thank you for watching. Bye.